Hi, I'm Steve Greenberg. I'm chair of the International Stroke Conference, and I'm here at the Hawaii Convention Center with the conference co-chair, Kira Becker. And Kira, this is sort of the calm before the storm. It's one day before the full meeting starts, but there's still activities going on today. What have you been doing today?
Well, Steve, there's a lot going on today. There's the Nursing Symposium, which has really been part of the conference for many years now, as well as the pre-conference meeting that's really directed towards stroke care for the primary care provider. Right,
and the one thing that impressed me about the pre-conference is how many questions there are that come up in just basic post-stroke care that are not so much the focus of the rest of the stroke conference, but really affect our day-to-day practice.
That's right. The attendees to this conference are clearly on the front lines in caring for these patients, and they have a lot of practical questions that they want answers for, and hopefully they're getting them at this conference.
So tomorrow the conference starts in earnest, and there are really a lot of different highlights to talk about. One, of course, that's near and dear to my heart is the next big thing session, which is really going to be something new that we haven't done before, in that we're going to ask a lot of people to go outside their comfort zones, and instead of giving purely a view of the past of stroke, to really try to look into the future and try in just 5 minutes to summarize where they think the stroke field might be going. Are any of the talks ones that you're especially looking forward to?
Well, Steve, I think it's going to be a really exciting session. It's in a very kind of energetic format. People will be excited, and I'm thinking this could become a new tradition for the stroke meeting.
Well, we'll see. I've said this is either going to be a great success or a noble failure, and we'll see which it is. Thursday, the second day of the meeting is going to be one of the exciting presentations that I think will galvanize people. The presentation of the IMS3 results. Can you sort of envision what questions you want to hear answered at that session?
Well, Steve, I think we're all aware of the fact that the study was stopped early for futility. I think the real questions are why? Why was it a futile study? Were there any safety issues? And anything that really seems to predict benefit from endovascular therapy? Right.
And of course, the endovascular theme will then reappear on Friday at the late breaking sessions, where we're going to hear a presentation from the MR rescue group. They'll be asking different questions from IMS3, and of course we really don't yet know the answer. Do you think this will affect the way people practice or the way people set up trials going into the future?
Can't say that for sure, but certainly these are the trials we've been waiting for. These are the first prospective randomized controlled trials of endovascular therapy, and this is what matters.
Besides the endovascular trials, which are really a major focus of this International Stroke Conference, what other trials are you looking forward to hearing about?
So certainly the blood pressure arm of the SPS3 study will be presented on Friday, and that will be very exciting.
I'm also I'm looking forward to hearing the results of the RECON study. So that's the arm of the ECIC bypass study that asked this sort of logical question: if we restore blood flow to the brain, can we improve cognition? And really raises the broad question of, can we do anything to prevent vascular cognitive impairment?
Yeah, and then I think finally there's the EMBRACE study that looks at the role of long-term cardiac rhythm monitoring to pick up patients with occult atrial fibrillation.
Okay. Could you talk a little bit about what we're doing to try to encourage junior investigators to have a more prominent role at the meeting?
Yeah, so the junior investigators have been encouraged to submit ideas for clinical trials, and they're going to have a luncheon with experts who are going to help kind of form those ideas into potentially grant submissions. The
other part of the agenda that's focused on especially junior people are the moderated poster tours, and I think those have been a great success. Whenever I've attended one of those, they're a victim of their own success, because often the crowds are so big that it's almost hard to hear the moderated discussion, but people are very drawn into that kind of spontaneous back and forth, and I think that's what makes the International Stroke Conference the place to be. There's no substitute for that kind of interaction that you can get directly with the people doing the research and your colleagues who are critiquing it. Well, there's not going to be much time for enjoying this lovely surroundings, but I imagine people may find a minute to enjoy the beauty of Honolulu as well.